Joining us now is Dr. Kevin Pham. He is a visiting policy analyst at the Heritage Foundation. Dr. Pham, thank you so much for being with us. In a recent piece you wrote, you focus on the pandemic response and center in on nursing homes. Dr. Pham, where did we go wrong with nursing home facilities? And in your opinion, why are they the key to controlling an outbreak?
They're the key to controlling the devastating effects of the outbreak, is what it is. Where we went wrong is that all of the pandemic response efforts should have been focused first and foremost on the nursing homes, because we knew very early on, as one of the few things we knew about COVID-19 was that it disproportionately affects those who are older, specifically 65 and older. There was a report in the CDC that back in March 18th that found that 80% of mortality was in those who are 65 and older. So all of the efforts should have been directed there first. And the fact that we still have a large number and an increasing number of cases in nursing homes means that we just haven't put enough good effort into protecting the nursing homes.
Dr. Pham, we've seen a large increase in testing here in America. Has it been enough, though?
Sheer numbers-wise, yeah, we've been routinely hitting over 1.5 million tests a day in November. So the numbers is pretty good. But what we really need to be doing is testing the people who are going in and out of these nursing homes. The NBA had this sort of bubble system where they tested people before they went in and worked the NBA playoffs. And I think a similar situation where you have nursing home workers working in or living in a dormitory on the premises, so they don't have to go in and out, and so they only need to be tested once when they come in. I think that would be something helpful. If it's good enough for LeBron James, it should be good enough for my grandma as well.
I think that is sound advice there. Dr. Pham, a CDC panel released new guidance that recommends long-term care facility residents like nursing home patients should be among the first to receive a COVID vaccine. Again here, why is that so important?
That is incredibly important because the nursing home residents are the ones who are most at risk. We know now that the majority of the transmission occurs within a household. And a nursing home is essentially a very large household where you're concentrating the most at-risk individuals. So the vaccines going to nursing homes or long-term care facilities, going there first, that would have the most tremendous effect on the severe effects of the pandemic. So that would be where it would be the best use.
And finally, just in a sentence or two, if you can, how many Americans need to be vaccinated to effectively put an end to the pandemic? And second part of the question, how do we reach a targeted vaccination rate if some doctors and nurses are on the fence about the vaccines themselves?
What you're asking is herd immunity. Right now, it's estimated to be about 60 to 70%, depending on what values we're finding here and there. But we should be looking at over half if we want to look at vaccination rates, although it does seem like the virus seems to slow down with about 20 to 40% of the population of a community who are immune to this. So that's when the virus starts to slow down. So we might not need that whole 60 to 80%, 60, 70, or 80% of the population to be vaccinated. To get to the needed level of vaccinations, then it really needs to be a public messaging campaign. A lot of people are skeptical about this,
right.
This vaccine, but it's important to remember that the acceleration was in taking out all the risk of the bureaucratic, the logistical concerns of a vaccination. All the safety precautions were kept in place, and tens of thousands of people have received this vaccine as part of clinical trials.
All right, Dr. Pham, we are unfortunately out of time. Thank you so much for being with us, Kevin Pham.
Thanks so much for having me.